What's up? I assume that you're watching this video because you're sitting in my living room, more or less, and you're waiting to be seen by myself. Well, shit, son. The reality is, I want you to know how to take care of yourself, okay? If you don't know how to take care of yourself, how are you going to take care of anyone else? For God's sake, we need you, man, woman, them, whatever you are. We need you. So, as it turns out, your oral health affects your entire body. They did a study of 4,000 people that lived above the age of 100. Okay? Do you want to live that old? I hope your life is decent. I would like to live that old. They found out that the common denominator between all 4,000 of these people that lived above the age of 100 was the health of their gut microbiome. You might be thinking, what the hell is a microbiome? Well, a biome is basically a bunch of different species that exist in some sort of place. Micro is a very, very small representative of that. The bacteria that are in your mouth. You're actually a walking universe. So the gut, the health of the gut is very, very important for your body. It's how much inflammation occurs in your system. It's how effectively food is processed into energy, basically how much energy you have over the course of the day. It's all about your mood, your emotions, and in general, it's also about how quickly you build muscle or how chub you are. Okay, a lot of that stuff comes down to the composition of your gut microbiome. So you might be thinking to yourself, Turab, Dr. Rai, how the hell do I change that? I want to live to 100 years old, or maybe I want to die tomorrow. Whatever the case, I'm going to tell you anyway. You eat better, man. You just fucking eat better, okay? Just eat better. Just be better. No, I'm kidding. So, basically what you got to do, okay, is you got to realize that human beings for the last 10,000 years have eaten animals, fat and protein from animals, and they've also eaten things that grow out of the freaking ground. Cheetos don't grow out of the ground, guys. Chips don't grow out of the ground. Coca-Cola doesn't grow out of the ground. What do people really... Alani sure as hell does not grow on trees, okay? In general, if you eat things that have a lot of fiber, naturally occurring fiber, things that have good fats, and things that have good protein, you're going to be a lot healthier. Why am I saying this? Because when it comes down to it, your cavities form because you're not good enough. No, I'm kidding. Your cavities form because you don't know that there's certain food that's really shit for you, and there's certain food that's not so shit for you, okay? On top of that, it matters less what you're eating in the beginning when you're changing things about your life. It matters less what you're eating, and it matters more how you're eating. Not what you're eating, how you're eating. So you can eat all the Oreos you want. You can even get stoned if you want. But how are you eating? So the reason I say this is, if you eat at 1 p.m., you're going to end up having an acidic mouth until 1:30. Okay? If you eat again at 1:30, you're going to have an acidic mouth until 2 p.m. If you eat again at 2 p.m., you're going to have an acidic mouth until 2:30. Okay? So, you notice how I use 2:30? Like that? Anyway, so 1 to 2:30, because you ate 3 times, you're not eating properly. What does an acidic mouth do for you? Well, it breaks down your damn teeth, which is not great for your entire life, and it's definitely not great for your gut microbiome. In general, when you have acidity in your mouth, you're going to have the outer enamel layer of your teeth break down. And when it breaks down, the bacteria can get inside the softer, squishy part called the dentin. And then it starts hurting. And then they keep going through the dentin, they get to your pulp, and then you're like, damn, I never want that ever to happen, ever, because it hurts more than giving birth. How do you avoid that? Take a step back. Protect your enamel. For God's sake, protect your a mammal. You're a mammal. Protect it. How do you do that? So basically, if you just stopped eating at 1 o'clock, if you just had a substantial meal at 1 o'clock, your mouth would only be acidic until 1:30. The cool part is, after that, after 1:30, your saliva would come in. Unless you smoke a lot, you have less saliva, but or you have a lot of medication, you have less saliva. At 1:30, your saliva comes in and it remineralizes your tooth structure. The outer protective enamel layer starts to get its mineralization back. You might be thinking, Turab, how the hell do you know this? Huh? How does this work? Chemistry, if you just look into it, the acidity of an environment will change how chemicals bond together. And as it turns out, your teeth are a type of chemical bond. It has a bunch of these little crystals in it that like bond together, okay? It has calcium in it and stuff. So in an acidic environment, that bond breaks apart, okay? It demineralizes. So the key here is to realize, guys, that I don't care in the beginning what you eat. I care how you eat. Because if you just freaking had a major meal at 1 o'clock instead of a bag of Doritos, then maybe you'd be full enough to not eat until 6 p.m. like a normal person that has a good dinner. And then you would have that entire period of time between 1:30 and 6 p.m. where your teeth remineralize. Your body would be working with itself to be better. And your entire ecosystem into your stomach would be healthier too, because your body can't be on all the time, okay? And because you've eaten something substantial, fibers, protein, some sort of fat naturally occurring, those microbes in your stomach are like, cool, we now eat the things that we're supposed to be eating. And then they change, the colony changes, the entire ecosystem gets friendlier to you. You produce more energy, you have a lot less depression, and in general, you heal faster and less stress, less inflammation. Less inflammation. What does inflammation mean? It means there's shit that's not right in your body, okay? Everything that goes wrong in your body comes down to inflammation. If you can reduce inflammation, you're gonna have way less disease in your life. As it turns out, is directly related to how you eat and what you eat. But first, get the how you eat right, because then the what you eat will necessarily have to change. You see the logic there? Change how you eat. Change how you eat, okay? Don't worry about what you eat right now. Just be like, okay, for instance, I used to get stoned a lot. Okay? Here's the thing. When you get stoned, you want to eat a bunch. It limits your ghrelin response, okay? And what that means is that you basically just eat a bunch of shit and you don't realize that you're eating for like 4 hours, okay? But what I started doing was like, okay, I know I'm gonna eat for the next 3 hours because I'm stoned. I might as well take all the shit that I'm gonna eat and eat it now and then be really full. Why? Because when I'm done eating, I can at least help my mouth remineralize. Another pro tip for keeping your mouth healthy is don't eat after you brush your teeth at night. Don't eat after you brush your teeth. Don't. And when I say eat, I know I talk a lot. I'm sorry. When I say eat, it's really anything besides water, guys. Eating to me is like, if you have anything that's not water, it's eating. It's like some form of snacking, some form of carbohydrate, some sugar source, some acidity you're contributing to your environment. Water is freaking amazing. Did you know water makes red blood cells? Did you know red blood cells carry energy in your body? So as it turns out, if you don't drink enough water over the course of the day, you just have less energy. If you don't drink enough water over the course of the day, you just have less energy. You ever wonder how much time and money you spend on your Alanis? It's because you're not drinking enough damn water. Pretty simple. Think about it. Take a second. This is Dr. Turab Rai with a public service announcement. You take care of yourself.